Thank you for coming to our organizational meeting for the Pittsburgh County Youth PrEP Initiative. HIV is running rampant among our young people, and something must be done to prevent infection. Oral HIV pre-exposure prophylaxis, also known as PrEP, is highly effective in preventing HIV that is spread through sexual contact. 15% of young people who have a need for PrEP and are eligible for PrEP are receiving PrEP. That means 85% of our young people who could benefit from this treatment are not receiving it. A lack of provider education and training has been repeatedly identified as the primary barrier in prescribing PrEP. We are proposing a tool, a clinical defense support tool, that will be based within our assessment, our patient assessment, that will help to identify young people who can benefit from HIV PrEP. For this to work, it must naturally fit within the current assessment. Our providers must be willing to have difficult conversations with the parents and the patients, and it must be clear in addressing PrEP without bias. In 2019, a children's hospital prepared a CDSS program that went live that assisted to educate the public and to get more of their students or their patients on PrEP. Prior to that rollout, 80% of providers had no knowledge of PrEP. Following the rollout, 90% said they had a knowledge, and 50% said they were comfortable in prescribing PrEP to their patients who needed it. What happens after our meeting today? We're scheduled a luncheon April 2nd with our providers to explain this program to them. We then also provided training April 16th and 17th to give them 2 days to come to training for providers and for nurses. After that, we'll be installing the CDSS program on the hospital computers, the health department computers, and on the adolescent medical ward at the hospital, with the hopeful rollout day of going live on May 1st of 2026. What I need you all to do right now, if you would, is send an email to itsupervisor@pittsburghhealth.co.gov to provide me with your email address. That will be our primary means of communicating in the next few weeks.